So the topic for today is about PRP versus exosomes. We already know a lot about exosomes and PRP. So I'll be just doing a comparison study for you as the time is very, very short for me and I'm only given 5 minutes. So how we select about the patients who are good for PRP and who are better for exosomes or any other combination treatments. So simple PRP and when it should be used, then exosomes therapy when it should be used, and when you use for the combination treatments, you will discuss about results of PRP versus exosomes and the comparison of those results. I have no personal interest in any conflict of this subject. So as we all know about the hair loss, it's an unfortunate condition that many adults deal with every day. Genetics, lifestyle habits, environmental factors all impact upon hair growth and its hair loss. So exosomes are best defined as extracellular vesicles, first described as such 30 years ago. Exosomes are divided into natural and engineered exosomes based on whether they have been artificially modified. Exosomes are not cells or tissue. Instead, they are produced within the stem cells and then released into the extracellular spaces. They have membrane-bound packages of effective nanoparticles 30 to 150 nanometer and present as cargo of RNA, DNA, protein, peptides, and metabolites. Exosomes in general are blisters that are charged to deliver both damaged and lost information to be implanted in target cells. They are derived mostly from mesenchymal stem cell for hair growth, and they are cell-free. It means they carry a low risk of tumor formation and other complications associated with stem cells therapies. They cannot self-replicate. It eliminates the concerns about potential tumor formation after stem cells transformation. The storage usually is for 24 hours, so the ideal temperature would be 4 degrees centigrade, and if you want to keep it for a week, then it should be minus 80 degrees centigrade. Now, how to differentiate when to use PRP and what is the difference between exosomes in that regard? PRP is derived from patient's own blood, while exosomes are derived from stem cells, fat cells, bone marrow, blood, and other resources. No anti-inflammatory properties are there in PRP. It elicits the body inflammatory response and can come with unwanted inflammatory tissue response. While in exosomes, anti-inflammatory properties are there. So it signals the body DNA to repair damaged cells and to heal the tissue. In PRP, the results vary on patient's age. If the patient is in 20-year-old age group, they will respond better to PRP. But as the results are not dependent on patient age in exosomes, these are derived from different resources with healthy young individuals, mostly 20 years range. So exosomes are healthy, they are strongest and not dependent on patient age in which these are needed to be injected. Again, in PRP, you will be seeing that the results vary on patient's age. So it yields inconsistent results as it yields, yes, less bioactive substances for older age. But in exosomes, they are consistent. They are lab-grown with high concentration of growth factors. In PRP, it's a bit painful procedure. You will take multiple vials of blood extracted from one process, and exosomes are mostly less painful, less invasive procedure due to the smaller molecule, and also they allow direct application onto the skin through microchanneling. They are easy to use. There is no drawing of blood. When you are doing PRP, it requires getting patient own blood drawn. Usually 3 to 6 treatments, one session, once a month, it's required. While exosomes, 1 to 2 treatments with a gap of 3 to 6 months is ideal. 7 to 25 growth factors are delivered in one PRP session, while 450 growth factors are there in 1 ml of exosomes. There's no ideal patient if you are doing PRP in anemic patient. I would not suggest PRP in anemic patient, but it's ideal in anemic patient if you inject exosomes. PRP is not legalized in different countries like Singapore, while exosomes are legalized in Singapore. Exosomes have 3-fold or even more growth factors than PRP. Different companies have been there. So usually when you're doing PRP, you can also combine it with exosomes or without exosomes. There can be red light therapy, there can be topical and oral supplements, microneedling, PDO threads is one other option, and there are home regimes with multivitamin therapies. Now, if we see a case of 22-year-old, only 6 PRP sessions are done with a 1-month gap, and you could see good healthy results in such patient if the age group is 22. So PRP works better in age group of 20-year-old. Same patient, if we go with the age group of 29, the PRP again will have good results. We have monitored that patient for over 15 months, and with 6 treatment results, they have given us very good result only using PRPs. So again, in age group of 20, 29, you will have good results. Another patient, 36-year-old, done 6 PRP sessions, and I could not see promising results as the age grows on. This is a patient, 42-year-old, done 1 exosome treatment, and the follow-up was from July to 23, and it was over a period of 28 months. Just 1 session was done, and we kept on monitoring the patient for 28 months, and you could see good results with 1 exosome session. Same girl. We have done this study over a period of like 2 years, so I'm sharing different months in which you can appreciate the hair growth and thickness. Similar patient, another patient age 45, and just 1 session was done over a time period of 11 months, and you could see the good results by the time 30th November 2023. Same patient, another side. You can even see the hairline has been improved with just 1 session, and we followed the patient for 11 months. Now, there are many patients, if we say if PRP is good for 20-year-old and not for 30 or 40-year-old, then how will you expedite the result of exosomes in young patient? This patient have been done multiple sessions of PRP from somewhere else in the past, but he was never happy. We asked him to do exosomes along with thread combination. Now here the reservation of the patient was just 1-time treatment. As he was moving abroad, he didn't have time, so we just continued with 1 session of exosomes with threads, and over 8 months period, you can see the hair growth already there. You could see May 2023 results with quite thickness, and the baldness have been reduced. As I said that in hair I combined exosomes with threads. Another patient age 56, same issue, no result for PRPs, so we combined exosomes with threads, and over a time period of 6 months, she really gave me good results. Now, this was the patient of PRP again. We monitored it for quite long, but I couldn't appreciate any good result with PRP, so we combined it, exosomes with threads, and you could already appreciate, and you could also see that there is quite area which was patchy before for the baldness, and with exosomes that has been covered with new hair. So in young patients aging 20s and around with no medical complications, anemia or low platelet count, opt for PRP 4 to 6 sittings. One session once a month is enough, and then follow after 3 to 4 months for maintenance sessions. In young patients who are in the age range of 30 or 20 and PRP regular systems are not like there, so you could reserve hair growth in such patient with combination treatment. In older patient, you will go with the exosomes, as I said, and that was the main topic for me. And few references are being there. Thank you.